you will find a CT scan, you'll find a complete theater, and you'll find a pediatric wing with oxygen that reduces the travel for Kenya to go and seek referral facilities or referral treatment in our level 6. I urge governors to sign the next addendums in order for us to operationalize the funds for maintaining these equipments. Finally, regarding the implementation challenges, Your Excellency, we have deployed county clinics, joint teams from MOH and SHA and DHA are visiting counties to resolve claims and system issues on the ground. So far, we have visited Kisii, Kisumu, Mombasa, Mandera, Embu, and Makueni. And this goes also for the faith-based and the private hospitals, so that any issues on how to lodge your claim, on how to deal with our digital superhighway, these clinics will help us resolve. And I want to single out Kenyatta National Hospital, Nakuru Referral Hospital as one of the, and Mombasa as one of the counties and referral hospitals that have done extremely well in making sure that their claim system is right and there are no rejections. Your Excellency, to conclude, I place the following urgent request before this council. Number one, correct bank details. I urge the governors, our governors, to instruct their county health CECs for finance, both health and finance, to provide us with accurate, verifiable details for over 1,287 health facilities immediately. We want to clear these payments by the end of this month. These facilities, mainly in our counties, over 1,000, we cannot pay them. We have their money because we can't pay them because of the details that they have provided are not correct when we check with the bank. So we really want that immediately resolved through the chair of the Council of Governors and the Secretariat. Two, we really want the county government to sign the National Equipment Support Program addendums. And I urge governors to facilitate the signing of these addendums for facilities where equipment is installed. This will unlock the flow of funds for equipment maintenance. Third, we urge the Council to fully implement the Facility Improvement Act. Revenue retained by facilities must be treated as an addition to, not to a replacement for the equitable share in the health sector. And fourth and last, we want counties to support us in the programs for helping the indigents in our country. We request more counties to follow the example of Murang'a and Mombasa in identifying and paying premiums for the indigents to ensure that no one is left behind. With your support in resolving these administrative and compliance hurdles, we will deliver a healthcare system that is accessible, affordable, and dignified for our people. Your Excellency, that is a brief. The document presentation is available. We will give it to the Council of Governors. We have county by county what we have paid, what is outstanding, what they're supposed to do, and we can share that with the Secretariat. But this is just a brief of our presentation. I really also want to thank the 10 counties in terms of registration. The county of Mombasa, Nyeri, Bomet, Elgeyo Marakwet, Kirinyaga, Tharaka Nithi, name it, the 10 top, who are now at an average of between 65 to 71. I really want to thank them because they're counties that are doing very well, and I really urge the ones which are at the bottom to make sure that they catch up with their colleagues. Thank you very much, Excellency.
Thank you, Waziri. A round of applause for CS Duale. Thank you very much for that very clear presentation. We now want to find out what the feedback is from the plenary. That's what Waziri Duale has said. Chairman Abdullahi.
Yeah, Your Excellency, I want to present a short report here in rejoinder on behalf of Governor Abdul Samad Sharif Nasir, who is our Chair of Health and who, because of other exigencies, could not be here. We take note of everything that the CS has said and presented. Excellency, SHA has been operational since October 2024, and we reiterate the county government's commitment, which has really been consistent in support of SHA, in change management adaptations, and in championing registration and aligning to the new health information systems across facilities. However, there still persists certain challenges which we have previously raised. We appreciate the position that this is not a technical working group discussion, but we just want to highlight from the Council's perspective what these challenges continue to be. Number one, unpredictable payment of PHC and SHIF funds. Though there was a commitment to pay by the 14th of every month, it's not happening, and especially for PHC, some of the counties have not received their funding from us. I think the last being September in some cases or October in others. So we'd want SHA to provide a predictable payment schedule for unpaid claims directly to counties, so that there's some predictability into this arrangement. Notwithstanding the issue of account details and other paperwork issues, the issue of rejection of legitimate claims being flagged off as fraud persists. Maternity services are no longer free. It's more fragments, access is restrictive, limiting care, and its affordability, and this will probably be taken in line together with the issue that we raised in summit, which he promised to intervene on through the PHC funds, of paying for deliveries at the level 2 and level 3. There are also system and network failures that affect service provision and claim processing, especially in places where internet is weak. So in our meeting on this matter, and we've been engaging with the ministry, we have come up with the following resolutions. With respect to cash flowing facilities, that SHA must demonstrate settlement performance for claims on services rendered, including reconciled remittances and predictable payment timelines. 2, payment schedule and arrears roadmap. SHA to issue a dated payment plan showing when outstanding arrears will be settled, county by county and facility by facility. 3, correction of misrouted payments. We're asking for immediate verification and correction of funds paid to the wrong facilities with written confirmation to counties, particularly in Kilifi, Turkana, Meru, and Kitui, that have actually raised those issues. On digital and claims system fixes, this is counties that have actually reported system failures. The Council recommends that DHA and SHA prioritize addressing all system issues, because SHA is very much system dependent. On maternity claim verification, There is need for urgent implementation of summit resolutions on reimbursements for maternity services at level 2 hospitals, including allowing mothers without IDs and teenage mothers without documentation from guidance access to care. Maternity should indeed be free for every mother. Last but not least, we are seeking targeted accountability instead of blanket sanctions. There should be written communication with justification prior to suspension or blacklisting of public health facilities from SHA. Your Excellency, that ends the official rejoinder as per the report from the Council's Committee of Health, but that doesn't preclude other governors who are here from making their input. I thank you.
Thank you very much, Chairperson COG. Before Minister Duale maybe responds to some of those issues, so it's not clear from me, listening to both CS Duale and Chairman Abdullahi, I am not clear what this IBEC is supposed to do. Because listening to both presentations, there are operational issues. You know, there are issues that are operational in nature, like on the issue of rejection of claims. The minister says, we need to put our documents together properly, and make sure that we don't have challenges with rejections, because it's electronic.